Hi there, this is Dr. Paul Firnhaber at Lincoln Disc and Nutrition here in Lincoln, Nebraska. And it is time for another edition of 10 Minutes of Truth. So today, I'm going to cover two different articles that I think are really important and really good. And these cover subjects that you need to know about. They're both out of the British Medical Journal, which is one of the top journals in the world. And they're both by essentially very similar authors, not totally exactly the same authors, but many of the same authors. The first one is published in July of last year, and it's called Association Between Chiropractic Spinal Manipulation and Gabapentin Prescription in Adults with Radicular Lower Back Pain. Retrospective Cohort Study Using U.S. Data. The second article is in June of 2 years ago, and this article is called Association Between Chiropractic Spinal Manipulative Therapy and Benzodiazepine Prescription in Patients with Radicular Lower Back Pain, a retrospective cohort study using real-world data from the USA. So what these authors were doing is they took two very popular, highly prescribed drugs for back pain and leg pain, and they wanted to compare them with the efficacy of the drug versus chiropractic care and what would happen, what that study would show. These were both really big studies, so the data is pretty darn accurate. So let's look at the first study, the one on gabapentin. Now there were 1,635 patients in each cohort. So 1,635 patients got gabapentin, 1,635 patients got chiropractic adjustments. The article says the authors hypothesized that adults under 50 years of age receiving chiropractic care for newly diagnosed radicular lower back pain would have reduced odds of receiving a gabapentin prescription over a 1-year follow-up. Now, there's a few facts in this article that I want you to be aware of. Number one is that low back and neck pain account for the leading cause of medical expense in the United States. That is a phenomenal statement in and of itself. Radicular lower back pain is often treated with off-label with gabapentin or by chiropractors using chiropractic adjustments. Gabapentin is an anticonvulsant, anti-epileptic medicine used as first-line therapy for several types of neuropathic pain, including diabetic neuropathy and herpetic neuralgia. Gabapentin has been used off-label to treat neuropathic symptoms of lower back pain for quite a while, actually since 1993, and it's been approved by the FDA for that since 1993. Now, here's a sentence from the article you need to hear. Systemic reviews in 2018 and 2022 demonstrate clear evidence of lack of its effectiveness for gabapentin in treating radicular lower back pain, or basically sciatic pain. There's a growing evidence of risks associated with gabapentin use, including abuse, misuse, dependence, and withdrawal. Other side effects of gabapentin include excessive sleepiness, dizziness, ataxia, meaning you have an unsteady gait, fatigue, and weakness or lack of energy. Several clinical practice guidelines do not recommend gabapentin for treatment of lower back pain or radicular lower back pain, including those of the American Family Physician. It says gabapentin prescription for lower back pain has been described as a marker of low value care and medical overuse. Despite the paucity of evidence, and in contrast to clinical guideline recommendations, gabapentin continues to be commonly prescribed for lower back pain. So what they essentially found out with this is that if somebody saw a chiropractic first with lower back pain or radicular lower back pain, their odds of receiving gabapentin dropped by 47%. And said our findings are similar to those of previous studies which demonstrate an association between initial receipt of chiropractic care and reduced odds of prescription of opioids and benzodiazepines. They're saying if somebody gets chiropractic care first, the odds really drop for those to get a drug, okay? Now here, this next article basically covered the exact same thing except using a different drug. Now this time they had 9,000 patients in each cohort, in each one. So let's just talk about benzodiazepines first. It's a class of psychoactive medication increasingly prescribed for patients with lower back pain and commonly used in patients with radicular lower back pain. Benzodiazepines are sedative hypnotic medications that act as central nervous system depressants and have anticonvulsant, and anxiolytic, which means antispasm, and muscle relaxant properties. The number of physician visits in which benzodiazepine was prescribed for back pain and chronic back pain in America more than tripled from 2003 to 2015. In a 2018 survey, 27% of lower back pain patients reported being recommended benzodiazepines by a medical doctor in the previous 12 months. So it says here, insufficient evidence supporting the efficacy of benzodiazepine for lower back pain and the risk of serious adverse events has led clinical practice guidelines to discourage their use for this condition. Recent clinical practice guidelines from the National Institute of Healthcare and Healthcare Excellence, Veterans Affairs and Department of Defense, Global Spine Care Institute, and Belgian Healthcare Knowledge Center recommended against prescribing benzodiazepine for lower back pain, while those of the American College of Physicians concluded there was insufficient evidence for their effectiveness in acute or subacute lower back pain. So, adverse effects of benzodiazepine include sedation, addiction, and increased risk of suicide. Dependence occurs in 20 to 100% of those taking benzodiazepines for at least a month. There's an increased risk of fatal accidental overdose with concurrent use of benzodiazepines and opioids. They're a risk factor in motor vehicle collisions, falls, and associated injuries, and may be explained by related psychomotor, balance, and cognitive impairment. Although benzodiazepines are increasingly prescribed for lower back pain, there is no strong evidence supporting their use for this condition. And what they found, the conclusions were, is that if somebody saw a chiropractor first before they were prescribed benzodiazepine, the odds of them getting a benzodiazepine prescription was only 44%. At 6 months, it was 39, and at 12 months, it was 33. So if you see a chiropractor first, the odds of being prescribed benzodiazepine or gabapentin go way down. And both these drugs have serious side effects. There's no evidence supporting their use for these conditions, even though they're prescribed a lot for them. And they have a lot of serious side effects. So again, for lower back pain or for sciatic pain, chiropractic is by far a better option and a better choice in either one of these drugs. So if you have these problems or you know people have these problems and they're on these drugs, have them watch this 10 Minutes of Truth. I could even get them these articles. I'd be happy to email them the articles. But the fact of the matter is chiropractic is much more effective than pharmaceuticals for back pain and leg pain. So you can call our office at 402-488-2220, and we'll be glad to talk to you, to screen you, and see if you're a good candidate for our office. Until next week, stay healthy, stay safe. God bless you, and I'll see you then.